Diagnosis of a spontaneous bacterial peritonitis. When will you make, doctor? When the WBC count is more than 500. There is a definition for that. Primary biliary cirrhosis involves intrahepatic bile duct. We'll try to run fast. In hepatorenal syndrome, what is the problem? Their liver dysfunction is there. Because of the cirrhosis, there is a severe ascites. Because of that, the intravascular volume is decreased. And because of that, there is a reflex release of a lot of vasoconstricting substances in the body. And those vasoconstriction lead to renal vasoconstriction. And that decreases the blood flow to the kidney. So it is a more like a pre-renal azotemia rather than intrarenal pathology. Decreased blood flow is causing creatinine rise. But still tubules are functioning. That is the reason they will retain the sodium. That's the reason urinary sodium will be low rather than high in case of hepatorenal syndrome. Yeah. So what you need to do is hepatorenal syndrome type 1, type 2. Today only after going home, you should take a chance to go through the video library, anatomytomedicine.com, HRS. We clearly discussed and debated 20-minute video. And if you at least go through the Davidson, your old sweet Davidson written about it half page. Because it's a very hot topic for the examiner. Now among this, the erythema infectiosum, when is it infectious? Even before the onset of the rash, it is infectious is what you need to basically remember. The triad of opioid intoxication typically has got a meiosis, respiratory depression, coma, but not any excessive lacrimation. Now, alopecia, impaired wound healing is zinc deficiency. Bernard-Solier is what? Bernard-Solier, von Willebrand, Glanzmann's thrombocythemia. These three are the functional platelet disorders. In all the three, platelet count will be normal. There is no problem with the platelet count. But von Willebrand factor is given, the cryoprecipitate is given to supplement the von Willebrand factor only in von Willebrand disease, not in the case of the Bernard-Solier. So Bernard-Solier is a platelet function disorder and von Willebrand also is a platelet functional disorder. Okay. So once more, doctor, what you need to do is after going home na, अच्छा बिरयानी खा के सो के उठ के एक निजामिया चारमीनार बिस्किट मंगा के एक अच्छा चाय बना के चाय पी के freshly बैठ के 20 topics which I did today wrong, you have to pick it up and then read them, listen them, the video in the video library, but strengthen yourself. Only 20 topics, finish, 4-5 hours you will take. खत्म. उसके बाद second show movie शालीमार theater में मारो, so चलेगा. So, but if you don't do that with all this heat of preparation and postpone it that बाद में पढ़ेंगे, that good day will never come. Today is the good day. So you should take that oath and promise to proactively reflect yourself to the wrong answers that you do in this mock test every Sunday. And those students who did that religiously are the ones who are the toppers among my students. And if 10,000 students take coaching, only 100 settle. All 10,000 take coaching. 9,900 do not make it. That many seats are not there actually, right? So that is a fundamental reason. But second reason also, if you look at those people who achieved it, they are really very competitively filling up the gaps which are precipitated by this mock test. That's how you should. Jogren has got a low complement levels. Jogren is a lymphocytic destruction of all the exocrine glands. Jogren has got rheumatoid arthritis like features, arthritis, along with involvement of exocrine glands, lacrimal glands, sublingual salivary glands, etc., etc. Now regarding farmer's lung, typically it involves upper lobe, not the lower lobe, is what you need to appreciate. Cryptococcal meningitis versus TB meningitis or bacterial. What is the difference? Pyogenic meningitis has a hypoglycorrhea, low serum glucose. But normal CSF glucose is a feature of cryptococcal meningitis. Hairy leukoplakia is caused by Epstein-Barr virus. It involves the edges of the tongue. Regarding the Alport syndrome, there is a deafness, not subluxation of lens. Then catacombs is whenever there is acute myocarditis, the heart got dilated, right? So whenever the increased blood is flowing across a normal valve, catacombs occur in acute carditis stage. Mitral stenosis is a chronic rheumatic heart disease. In acute rheumatic heart disease, when the carditis is there, the heart is dilated. That time when the blood is flowing across a normal valve, that lead to development of a diastolic murmur. So it is typically a diastolic murmur. All causes of FSGS, you must be 100% sure. HIV, heroin, sickle cell disease, obesity, etc., etc. What tumors are amenable to the cancer therapy? Chemotherapy. So you must know in adults, in pediatrics, what are curable by giving chemotherapy and what are chemoresistant. Be very sure. Painless grass hematuria, elderly person, unless proven otherwise, is bladder cancer. Internal hemorrhoids with prolapse that require digital reduction are basically third degree. A patient has history of road traffic accident 8 hours back. External urethral meatus is showing few drops of blood and he has not passed the urine, and you don't pass Foley and complete the incomplete job of the God. Be sure about it. So urethral injury is the one which you need to basically suspect. Now typically most of the times hematomas are benign and they don't transform into malignancy. But when hematomas occur in Peutz-Jeghers syndrome, as an exception, then they have a chance of becoming adenoma and later on carcinoma is what you have to basically remember. Now, breast cancer with P10 mutations, you call it as Cowden disease. So BRCA1, BRCA2, P10, etc. they are all the genetics behind breast cancer. This is a very painful question. Carcinoma tongue staging. Sometimes some cruel examiners still give. So generally carcinoma cervix, endometrium, and if you remember, more than enough. So I leave the literature for you. In order to expose the celiac axis in case of a trauma, what do? So there is a technique of left medial visceral rotation which will expose you some of the underlying organs which are below the mesentery. So I leave the literature for you to study about Cattell's maneuver, Koch's maneuver, what are the differences. If you look at the branchial anomaly, commonly it is due to the second branchial remnant, most commonly the branchial anomalies occur. Then in cholestasis, 5-nucleotidase, whenever obstructive jaundice is there with cholestasis, alkaline phosphatase is elevated, gamma glutamyl transpeptidase is elevated, is what you need to remember. Ranson's criteria, typically what is serum calcium's role? So there are some which are measured within at the time of admission and others within 48 hours. So accordingly you must know what are measured when, during initial 48 hours and at admission. Now if you are doing the stoma, opening up the gut to the exterior, what are the different types of stomas that you can do and where do you want to open the stoma? If it is a ileostomy, ileum you are opening, then the right lower quadrant is the optimum location. Then for sigmoid or descending colostomy, then the left lower quadrant is optimal, but if the conditions are not um, uh, conducive, then you can put it in left upper quadrant. Then transverse colostomy, left upper quadrant once more. What are the most common indication for ileostomy? Ulcerative colitis. Then for the development of the gallstones, combined OCP, not progesterone only pill, is the risk factor. Then for the small bowel obstruction in a 75-year-old female who has got biliary coli with multiple air fluid levels, what is the likelihood? Typically gallstone ileus will go and obstruct the ileum, and that small bowel obstruction lead to air fluid levels. That's the underlying diagnosis. Depending upon the type of choledochal cyst, different therapies are done. Type 1, you will do an excision of the cyst and do a Roux-en-Y hepatico-jejunostomy. Like that 2, 3, 4, 5. You need to go through the topic of choledochal cyst in a more greater detail in the surgery part of the video library in the anatomy2medicine.com. Sentinel loop sign on the abdominal X-ray. Where do you see? Whenever pancreatitis is there, the overlying gut will go into a peristalsis and air will accumulate there. And looking at that stagnant air, right, and a cutoff of the air column, you will recognize the underlying pancreas is the one which is inflamed. So that's called sentinel loop sign in case of acute pancreatitis. What tumor marker is best for the treatment of adenocarcinoma pancreas? CA99, classical one. Inferior thyroid artery, it arises from the thyrocervical trunk of subclavian artery. Then superior thyroid artery arises from external carotid artery. Then what conditions makes TBG, thyroid binding globulin, to increase? Pregnancy is a common condition. It is a non-tender diffuse enlargement of thyroid. It's a classical story of Hashimoto, most common cause of the hypothyroidism. Then for subtotal thyroidectomy, what are the indications? Pregnant, breastfeeding, young patient. You should just review what are all the indications for subtotal thyroidectomy instead of total thyroidectomy. One of the favorite areas of the examiner. For a toxic multinodular goiter, how do you treat? We do the lobectomy with a subtotal thyroidectomy on the other side is considered to be the surgical management for toxic multinodular goiter. For every 10 mm of PaCO2, how much will the pH decrease? Obviously, hypercarbia lead to respiratory acidosis. Respiratory alkalosis, CO2 is low because we are hyperventilating, right? So typically it will, pH will decrease by about 0.08 is what you need to basically remember. Now about the HIV and pregnancy. Vaginal delivery increase the chance of transmission, whereas cesarean decrease the chance of transmission is what you need to understand. Then what is the most common congenital anomaly in case of IDDM mother, the baby born? Most characteristic is caudal regression. Most common is cardiovascular, right? A lot of people have a problem with this question. A lady has infertility with bilateral tubal block, and how do you want to manage? So basically you want to do laparoscopy, hysteroscopy as a part of the evaluation in tubal block. Then what are the common complications in a baby born to the diabetic mother? Hypocalcemia leading to seizures, tetany, they are all the important issues. Then for the management of TB in the mother, so if the mother is breastfeeding, if you happen to give streptomycin, there is a high risk of ototoxicity to the baby is a wrong statement. Most of the drugs are safe for a breastfeeding mother. A lot of times people abstain from giving a lot of medicines just because mother is breastfeeding. Not really, right? So now regarding the red degeneration of myomas, There is nothing that you need to do. It is an aseptic condition. No need of any antibiotics is what you need to understand. Hypothyroidism in pregnancy, what is it associated with? PIH, recurrent abortions, preterm, they are all associated with hypothyroidism, and it can lead to IUGR, subnormal intelligence, stillbirth, etc., etc. Right? Of course, don't add not getting seat in MD is because of the maternal hypothyroidism. So, one of our friends used to add this kind of things. Down syndrome features include, we all used to sit and read aloud. Oh, getting seat for MD was not a, though we say it is very easy play now after training so many batches. But even our days it used to be a struggle. So one of our friends, Down syndrome include hyperthyroidism, Mongolism, and not qualifying in AIMS MD entrance. In fact, he used to read in Davidson, as such everyone used to believe. In fact, the most specific signs of all this, according to the international trials, is not qualifying in the AIMS MD exam. So please do a karyotypic analysis if you are recurrently failing in MD entrance. Not only you do for yourself, for all your cousins who are also studying in medical school, because there is a chance of Down syndrome being prevalent in the first degree relatives. So that way. But we used to say, hey, your cousin sister got in AIMS Nare. So that means the theory could be wrong, we used to say. So yeah. So whenever we meet today, some of those guys in the group are cardiologists, some of them are very top level gastroenterologists doing ERCPs, MRCPs left and right, not MRCP, ERCPs left and right, PDCAs. So whenever we meet, we just remember those great good olden days and really enjoy how we all evolved. But only one dream used to be there, that we were always sure that we are definitely much better than many moronish classmates. We used to consider all others are idiots and we are the only one who are better among that group of idiots among our classmates. So that kind of at least a false confidence you should have continuously. That's the purpose you should go to reading room. So that you will discover more miserable lives than you, more pathetic conditions, and those who are at protozoan level, at least you are at amphibia, Nematohelminthes, Platyhelminthes level in your preparation. You will find completely protozoal. Yeah, ये टॉपिक सर्जरी में आता है या ऑर्थोपेडिक्स में आता है बोल के पूछने वाला भी रहता है. Which book to find also people will have confusion, will come to reading room just to encourage the others. So be sure. So cardiovascular changes in pregnancy, typically the increased cardiac output is because of two things. Increased heart rate or increased plasma volume. But actually plasma volume increases in pregnancy. That increases the cardiac output. Along with the cardiac output, there is also increase in red cell volume. But the red cell mass increase is lesser than the increase in the plasma volume. Hence pregnancy is called a state of hemodilution, is what you need to basically remember. Now, about the hemodynamic parameters, which is decreased in pregnancy. If you take systemic vascular resistance, actually it will decrease now. I think some except should not be there. Systemic vascular resistance decreases because there is a vasodilatation. So I leave the literature for you on what are the parameters that unchanged, decrease, increase, etc., etc. Okay. So conization basically is indicated in which scenario? Just because pap smear shown high degree lesion is not an indication of conization. But if colposcopy is unsatisfactory, what is meant by unsatisfactory colposcopy? When you do colposcopy, you are supposed to view the squamocolumnar junction. Sometimes when colposcopy is done, squamocolumnar, if it is not visible, then that is called unsatisfactory colposcopy. Then if you have done histology and suspecting carcinoma in situ, that is also an indication for doing the conization. Just based on a cytological picture of pap smear, you cannot jump into doing the conization, is what you need to be very, very sure. And remember, doctor, every entrance you go, the protocol of evaluation of cervical dysplasia, favorite question. आज नहीं तो कल नहीं तो परसों पढ़ना ही पड़ेगा. So आज ही पढ़ो. If you have done this wrong, what is the typical algorithm? What will you do if it is CIN1, CIN2, CIN3, and if it is a endocervical, adenocarcinoma suspected, then what do you want to do? All those Bethesda guidelines of evaluation of cervical dysplasia, you have to be 100% sure. 42-year-old, long-standing diabetes, constant dribbling of urine with coughing and lifting. So what is the treatment you want to basically give? Typically long-standing diabetes is a risk factor for neurogenic bladder. So when neurogenic bladder is there, the bladder becomes stagnant. Can you close the door? So that is a scenario where neither the surgery nor the urethropexy will be helpful, and you need to do intermittent catheterization is considered to be the management. What is the most accurate thing about varicella zoster vaccine? So varicella zoster is a live attenuated vaccine which is recommended for all the individuals aged 60 and above, and it will decrease the incidence of the herpes zoster, is what we need to appreciate. 18-year-old adolescent female, she has not had PAP previously. She began sexual intercourse a year previously. What is the most accurate thing about it? So for you to start a screening cervical cytology, what is the typical age? So you should defer doing a pap smear until 21, or if somebody started sexual intercourse, then at least 3 years of track record of sexual intercourse must be there. After 3 years only, it is an indication to go for pap smear, is what you need to understand. 37-year-old from Patna who has not started her menses since a vaginal delivery 1 year previously complicated by postpartum hemorrhage. She was unable to breastfeed. Sheehan syndrome. Whenever hypopituitarism is there, the prolactin levels decrease. Sheehan is a consequence of hypoperfusion to the pituitary due to the hypotensive shock caused by the exsanguinating bleed of the postpartum hemorrhage. 34-year-old at 39 weeks of gestation with painful uterine contractions. Her cervix has changed from 1 centimeter to 2 centimeters over 3 hours. Then what is the best thing that you want to do in her case? You need to do cesarean only for the disorders or arrest or non-progression of an active phase of labor, not latent phase. So this is basically a delayed latent phase. That's the reason observed is what you need to do. 28-year-old GP21, G2P1 woman at 41 weeks of gestation. Occipital posterior position is there. And the station remained at station 0, and in spite of a complete effacement, then what is the true statement about it? This is typically called arrest of descent. Whenever the second stage of labor is abnormal, even 3 hours of second stage of labor is abnormal in spite of epidural analgesia. With and without epidural analgesia, nulliparous versus multiparous, all the durations will differ. So the table is there, no, datta lo. Datta mein, what is the definition, what is the time duration expected during each phases of the labor? You have to be 100% sure. So the baby remained at 0. That means it didn't descend at all. So it is a failure of descent. 27-year-old at 39 weeks, painful uterine contractions, dark vaginal blood mixed with some mucus, So what do you like to describe it as? It's a classical bloody show is what you need to basically remember. And if a labor is about to start, impending labor, then 39-week gestation, there will be a bloody show or a loss of cervical plug is what you need to basically remember. So, pregnancy, midwifery, management of obstetrics, one life will be over. And you see some of the senior obstetricians, if you ask them, no, they still feel they just passed out their MBBS. Oh, spirit, young at heart rehte. And for every labor, they feel like that is the first labor that they are delivering like a postgraduate. If you look at some of the caring obstetricians, right, they might have seen a lot of labors. Of course, it is a laboring woman who delivers. They have nothing to really construct or build over it. But the point is how carefully you manage like a pilot. Pilot also sits in the cockpit of the flight. His job is what? Proper landing, looking at the weather and reporting. Currently there is a very bad weather, tighten your seat belt. Like that, and an obstetrician, your job is to carefully monitor to the progression, and whenever required, you have to pull the cesarean button, right? So that's the reason, if you have passion, only take obstetrics. If you don't have passion for obstetrics, see doctor, we will be born with some passion on one particular division, remember. Some will have a love to do psychiatry, some will have love to do dermatology. That love to do a particular branch actually starts at some subdued level right from our MBBS days. So don't think this branch is better, that branch is better, and all that is bakwas actually. Ultimately, if you marry something that you don't want to, even though that is the best thing according to for everybody, it is not best for you. So that's the reason you make a personal choice what I will enjoy from day to evening if I want to do that. Then you will become great clinicians. So what is the most significant factor for the ectopic pregnancy? Prior chlamydial infection, which is very rampant, is the most important risk factor. A 24-year-old woman at 5 weeks of gestation, blood pressure is low, heart rate is high, HCG is 500, no head neck cell masses, no intrauterine sac. So it is a ruptured ectopic pregnancy. Ruptured ectopic pregnancy is like declaration of war. It's a surgical emergency. No waiting and watching. Jump into the theater and arrange the table and call the anesthetist and do the immediate surgery. A 36-year-old endometrial cavity was not entered during the procedure and she has undergone myomectomy. Now what is the chance of placenta accreta? So, placenta accreta typically occur whenever the endometrial cavity is being damaged, and at the time of implantation there will be a deeper implantation into the myometrial surface that lead to accreta, right? And what is the complication of accreta? Accreta lead to retained products of conception, and also it can lead to development of atony of the uterus and predisposed to PPH. A 17-year-old has yellowish vaginal discharge, cervix is erythematous, numerous leukocytes, classical of chlamydia. Then fishy odor, classical of bacterial vaginosis. Then a 58-year-old with total abdominal hysterectomy develops fever and flank tenderness. So what is the favorite injury of all gynecologists? Ureter. 1+1 offer दे देते. Uterus निकालते साथ ही साथ ureter को भी damage करके निकलते. So that's the reason they often marry urologists to be safe. If your hands are shivering and you are not sure that they will go here and there, and still you took MD gynoc seat and forced to do hysterectomy. See, your history you will only know, no doctor. While you are eating food, you are throwing a lot of things out of the plate and your grandma keep yelling on you that why don't you eat neatly? better not take surgical branches. You will be make everything messy and come out, right? So, what is the risk factor of endometrial cancer? Diabetes is a risk factor for endometrial hyperplasia. these are all actually well related. Diabetes common in obesity, obesity lead to high estrogen lead to endometrial proliferation. So that's how these are all interlinked. Then 52-year-old postmenopausal woman, pap smear was performed and she does not have history of any abnormal pap smear, but there is atypical glandular cells. What do you want to do? You want to do an endocervical curettage, endometrial sampling, colposcopy. They are all indicated in this given clinical story. So what is most important therapeutic measure for a 52-year-old who has got stage 1 endometrial cancer? Typically surgery. So you must know according to the stage 1, 2, 3, what are the options available, when do you want to do radiotherapy, etc., etc. Note the risk factor for placenta previa. Multiple gestations will basically increase the surface area of placentation. Twins bole to jada placenta. So all that placenta will come and implant closer to os, and that increase the risk of previa. So what is the typical feature of placenta previa? Placenta previa can lead to postcoital spotting if there is intercourse at the time of pregnancy. A 22-year-old female, marginal placenta previa, ultrasound at 22 weeks of gestation is showing that. And what is the most appropriate management in her? Fundamentally, placenta also is like a mock test score. As you keep writing more and more mock tests, the score will increase. So in 30th week, placental position can improve as you go over a period of time. So you can still observe. You cannot jump into conclusion of final placental fixation. A 35-year-old woman with microadenoma of the pituitary. Can you give bromocriptine in pregnancy? Yes, bromocriptine is a safe drug in pregnancy, especially if the pituitary adenoma size increases in pregnancy, compressing the optic chiasma, then you need to definitely decrease the size of it, and for that you can very much give the oral bromocriptine therapy is what you need to understand. So that is the story in short, doctor.